Let's talk about the opioid crisis in healthcare. You're dealing with this in New Jersey as well. And this week, you're putting out for Mother's Day an ad that shows a woman, Pam, who's facing her first Mother's Day. We're going to roll part of it right now, facing her first Mother's Day without her son, who died from drug abuse. Should Pam and other moms be worried about this GOP healthcare bill that passed last week and what it could do for those who are facing addiction?
Listen, I don't think so. I think there's going to be a lot of work done. You know how the way this process works, George. I think the Senate will do a lot of things to change the bill as it is now. And I've said really clearly that, we expanded Medicaid in New Jersey.
This cuts it back.
Well, that's right. By 2020, it wouldn't. And so I think there's going to be a lot of discussion about that. And you see a lot of Republican governors out there expressing their concerns, both publicly and directly, privately, to folks on Capitol Hill and the White House. And there's a lot of work yet to be done. So I don't think this is a final product. And having gone through 7.5 years of legislative process as a governor in New Jersey, I understand that nothing really is final until it reaches your desk. So I don't want anybody to overreact, but we're certainly going to express our concerns.
Because there are some serious concerns people have. If states wouldn't have to consider addiction treatment an essential benefit right now. Is that a good idea?
Well, listen, I think that most states would consider it an essential benefit, George. I think when you have 52,000 people last year in the United States dying of drug overdoses, more than car accidents and gun homicides combined, that I don't think you'd see any governor in any state say we don't think it's an essential benefit.
Why give them the ability to do that?
Listen, I think that this is a difference in philosophy. I believe that governors should be trusted to make these decisions, and that they know what's best for the people in their individual state. Now, this is just a general difference in philosophy between Democratic and Republican administrations. As Republican governors, we've been clamoring for 8 years to give us more control. And my argument to President Obama at the time was, why do you think it would be a good move for me as a governor to deny the benefit of getting drug or alcohol abuse treatment? It's not good from a public health perspective, and it's certainly not good politically.
But I guess one of the big questions is, can you do that when your state and others are going to get their Medicaid funding cut back? $880 billion in cuts in Medicaid.
Well, first of all, you can do something if you let us manage ourselves a little bit better than what we do now. Everything we do in Medicaid now, George, even though we pay 50% of the cost in most cases, we have to go mother may I to the federal government to ask them to make changes. No one thinks that the way I give health care as a state in New Jersey should be the same as the way they do it in Wyoming. Okay, it's different public health issues.
But you need the money.
Well, yeah, but you can manage the money better. And I think what we should move towards is to allow governors to manage this money and to create savings both for the public and for the federal government.
We also saw a proposal last week that was cleared by the Office of Management and Budget that would cut funding for the Office of National Drug Control by 95%. Wouldn't that cripple your work on the commission?
Yeah, I just don't believe it's going to happen.
So have you expressed that to the president?
I just don't believe it's going to happen, George.
But it's their proposal.
I have a good reason to believe it's not going to happen.
You've been assured it's not going to happen?
I have good reason to believe it's not going to happen, George.
So you feel that there will be full funding to take on the opioid crisis?
I believe there will be funding, and I think that funding will take different forms as well. Let's face it, there's a GAO report out there that was issued near the end of the Obama administration saying that ONDCP was not effective. Okay, so I think what the administration is doing is the right thing, which is to say, and this is one of the charges the president's given me in the commission, is to say, look at the way we're spending this money across a number of different departments in government. So remember, ONDCP is essentially a conduit, the Drug Czar's office too, Health and Human Services, Education, State Department, and others. So one of the things the president wants me to do is say, how can we spend this money better? Because we're losing this fight. We're losing the fight, and we can't afford to lose the fight, George. 52,000 people dead last year in the United States. Can't afford to lose the fight. I am assured and feel very confident that the funds that we need to do it may not look the same way, but hopefully it'll be more effective than GAO found ONDCP to be.
Governor Christie, thanks for joining us this morning.
Thank you, George.
Robin?